Hello everyone, I am Dr Shivani Chandan, consultant obstetrician and gynecologist at Aster RV Hospital. Today we are going to talk about this condition called PCOS, which stands for polycystic ovarian syndrome. Now PCOS is one of the most common hormonal problems in young women, and also there's not a single day when we do not see we definitely see at least one patient of PCOS in our OPD on a daily basis. Along with that, September happens to be PCOS Awareness Month. So we have taken up this topic so that we can clear all the misconceptions surrounding this condition. Along with that, we are going to talk about the diagnosis and the available treatment options. Now, the main pathology in this polycystic ovarian syndrome is anovulation. That is, in a normal menstrual cycle, mid-cycle, there is a release of egg from the ovary, which is called ovulation. But in PCOS, this ovulation is not happening. Instead, the mature follicle gets collected inside the ovary, causing multiple fluid-filled follicles in the ovary, causing the polycystic ovarian syndrome. I have with me Dr. Sunil Eshwar, our lead consultant in the Department of Obstetrics and Gynaecology. Sir is also a laparoscopic surgeon and infertility specialist. So sir, can you elaborate on how this condition is diagnosed?
Well, as we know that this is PCOS Awareness Month. Now, there are certain things which our patients need to be aware of. We do get lots of patients coming and telling, sir, I have PCOD, just because someone has told, or just because they have missed one or two cycles in that year, or it's just that, some scan which says you are polycystic ovary. So, what's the difference between polycystic ovaries, polycystic ovarian syndrome, polycystic ovarian disease is very important to understand here. Any woman may miss her cycle once or twice in a year because of lots of reasons, maybe travel, stress, or some hormone imbalance, maybe because of other hormone things like thyroid, prolactin, not necessarily polycystic ovaries. Polycystic ovaries are defined as where the size of the ovary is more than 10 cc, or there are more number of eggs or follicles which have accumulated around the ovaries. More than 10 follicles is what we call per egg, okay, so per ovary. So that is polycystic ovaries. When you talk about polycystic ovarian disease or polycystic ovarian syndrome, it comprises of certain other conditions also, like polycystic ovaries associated with amenorrhea or prolonged oligomenorrhea. Means to say that the cycle duration is more than 35 days or 40 days. So she gets a period after 45 days, 2 months, 3 months. If that happens regularly, at least 3 cycles should happen like that, then only we would say it is a irregular periods. Next is, they should also have certain amount of male kind of changes, like hair fall, male kind of baldness, little bit of more of acne, hair growth, obesity, which we call it as truncal obesity. That means there is more fat accumulated around the trunk region, not on the hip. So this, when we all put all this together, it forms a polycystic ovarian disease. That is polycystic ovaries, oligomenorrhea, along with male pattern kind of androgenic symptoms. When these are together, then only we call it as polycystic ovarian disease. Just because one cycle you missed and some scan says you got polycystic ovaries, it doesn't become a polycystic ovarian disease or a syndrome. Whereas the diagnosis is classical diagnosis, depends on, one is, as I said, the scan finding, clinical history. That is, you should have had irregular period for quite some time. You should have a little bit of the androgenic symptoms like baldness or hair fall or acne or even the hair growth. Hirsutism is what we call it. If these things are there, then we call it as clinically, yes, it's polycystic ovaries. We do advise certain blood tests, basically to look at hormone changes, which would kind of direct us how to manage or how to treat you. Basically, the hormones which you do is follicle stimulating hormone, luteinizing hormone. There is a time period when we are supposed to do, that is very advised between 2nd day to 5th day of the period. Early morning better than any other time. Along with this, we can also do serum AMH levels. Then there are certain other tests to see what is it really polycystic ovarian disease or any other condition which is causing irregular periods. thyroid disorder, so we'll have to check thyroid function test. Then we will check for serum prolactin levels, because it can also cause ovarian dysfunction. Along with that, there are other hormonal disorders which can also mimic polycystic ovarian disease, like hyperandrogenisms or androgenic disorders. They will have male pattern kind of thing, but polycystic ovaries may not be there. So there are certain hormone tests which you need to do. So what we suggest is, any woman who has irregular cycles needs to be investigated, but they have to remember that there has to be a distinction between this irregularity is definitely because of polycystic ovaries and not because of anything else. Because we have had patients where they've been treated as polycystic ovarian disease because they have purely irregular cycle or oligomenorrhea, and we diagnose that there is because of thyroid disorder, or there is another condition where the number of eggs are very less, low ovarian reserve. They can also present with irregular cycle. So that is a criteria which we like to look at. So another thing which I want to ask, as we are already discussing, irregular cycle, does it always mean polycystic disease, or it can be anything else?
Yeah, like sir was just explaining. First of all, irregular cycles means you're not having regular periods. The gap is more than 35 days. And it's not one cycle. It's when this irregular pattern is recurring and repeating itself. That is when we call it as irregular cycles. So before we call it as PCOS, there are multiple causes for irregular cycles which have to be ruled out. The first most important thing is that when someone attains puberty, initially the few cycles can be irregular. So just because initial 1 to 2 years can be irregular, just because the cycles are irregular doesn't mean it's PCOS. At the same time, when the patient is around the age of 45, pre-menopausal, also the cycles can be irregular because the number of follicles have come down. Right? So apart from this, there are also a number of other emotional and stress. Stress itself is an important cause of irregular cycles. Stress, reduced sleep, increase in weight, sudden loss of weight, all these conditions can also cause irregular cycles. Apart from this, we also need to rule out thyroid issues. Any thyroid hormonal issues can again cause irregular periods. So just because you have one symptom of irregular cycles does not mean you have polycystic ovarian syndrome. Like sir said, we look at least 2 of the 3 features that sir has mentioned. One is irregular cycles. Either the scan shows a polycystic ovarian appearance or any increase in main hormonic features. So that is what I mean, that irregular cycles does not always mean PCOS.
As you correctly said, irregular cycle can be because of one thing which I will always say in the reproductive age group is, we do get scans, but telling that okay, it's a polycystic ovaries, our patient has irregular cycles. Most of the time, we insist on a transvaginal ultrasound if the patient is already married. This is because it gives us a better picture of the ovary. So we will be able to pick up if there is any other hormone secreting problems. Also, which I would suggest is also look at something called as antral follicle count. Because we have had patients where they've been treated as irregular cycles because of, telling it is polycystic, and we came across that it was because of premature ovarian failure. So it should not be that you've been wrongly diagnosed in a different basket. So when we talk about irregularity, I think there is very much a need for a transvaginal ultrasound if you are already married or sexually active, hormone analysis to make sure that we are not dealing with something else which can be very easily treated, or the treatment is totally different. So,
since we're talking about so much about the diagnosis and irregular cycles, now once it is diagnosed, is there a cure for PCOS?
See, as we were telling, scan findings, many a time our patient would come and say, sir, there is a cyst in my ovary, or water-filled balloon in my ovary, or in Kannadadalli helbekandre neeru gulla ide anta heltare. So actually there is a difference between polycystic ovaries and a cyst in the ovary. Cyst in the ovary is a water-filled cavity which can be 1 or 2 or a multiple also, whereas a polycystic ovaries, as you already explained it, is increased number of follicles, that is eggs, which have not matured completely to become a mature and a good egg. So they generally tend to accumulate in the ovary. So when you talk about cure of polycystic ovaries, we need to understand why polycystic ovarian disease happens also. Polycystic ovarian syndrome or disease can be classified into two different separate thing. One is a lean PCO and one is an obese PCO. Lean PCO is one who has normal BMI or BMI is which is less than the normal. And when we talk about obese PCO is where the weight or the BMI of the woman or a girl is more. When you talk about lean PCO is mainly a genetically oriented one, or the family history is there. So it's a bit difficult to treat them considering the irregularity. So is more. Whereas when you talk about obese PCO, the treatment becomes very easy. In sense that obese PCO, if they change their lifestyle and modify certain things and try to lose weight, most of the time the condition, that is the disease part of the polycystic ovary, is cured. That means you may tend to get your normal regular periods, your hair loss may reduce, your male pattern kind of hair growth may reduce. So this can be reversed if the patient actively indulges in changing the lifestyle and getting back to normalcy. Whereas a lean PCO, yes, it is a bit difficult. But again, when you talk about cure, we don't really focus too much on curing or reducing the size of the ovaries. We try to focus on the other aspect of the polycystic ovarian syndrome, that is the syndrome part of the ovary. That means irregularity. If the irregularity of the cycle is an issue, then probably we can put them on some hormone treatment to regularize it. If it is again because of hair fall or acne related problem, then again we can put them on certain treatments. Yes, if it is associated, as we all know that polycystic ovary is one of the most common cause of subfertility. I would not call it as infertility, considering that most of this polycystic ovarian disease or syndrome women end up having pregnancies. Okay, so it's more of a subfertility. So when subfertility is concerned, then we can treat according to whether the pregnancy can be achieved or not. So as we know this, that there is so much of variation, lean PCO, obese PCO. So another thing which comes in, many of our patients ask, like, is it familial? Because it becomes easier for them to say that because all my family members are on the obese side, or they have polycystic ovaries or some other issue is there. That's why I am like this. So is there any evidence which really says that?
There is no exact etiology, exact cause leading to PCOS. But what we have seen in multiple studies and multiple cases is that there is a familial component. That is, there is some amount of genetic changes which cause PCOS. Because you usually see that if a woman is suffering from PCOS, she has one or the other first degree relative suffering from the same condition. It could be her mother, her sister. So yes, there is a genetic or a familial component in PCOS. So if you know that your mother has had PCOS, it's good for you to start working out and start looking at solutions at an earlier stage, like the lifestyle changes and diet that we're going to talk about. That can be, you can take that step beforehand itself. Apart from this, we have also seen that there is a component of insulin resistance in these women in PCOS. See, what happens is, though the insulin is being secreted, there's a lot of resistance to this hormone. Because of the resistance, more insulin is secreted. This insulin in turn increases the male hormone production in them, which leads to all the male features like acne, the hair loss, the male pattern hair loss. The weight gain is in the abdomen, like the male pattern where they gain weight. So this insulin resistance is a huge component in PCOS, and that makes even weight loss little difficult. So in such cases, we may need to give some certain medications which will help them to lose weight.
So yes, as you rightly said, there is definitely some amount of familial component, but as you rightly said, some lifestyle changes, avoid junk food. We've seen, from childhood, there's a habit of drinking lots of Coca-Colas, you're eating too much of cheese, less of physical activity. All these things, yes, present in adult or an adolescence with these kind of hormonal imbalances.
So coming to the weight gain component of PCOS, does PCOS cause weight gain, or does weight gain in turn cause PCOS? What is it actually?
This is again very interesting. So, this is a very common question. When we say why have you put on weight, or many a time we see after marriage there is a sudden gain in the weight, and then the periods become irregular, they have difficulty in conceiving. So most of the time a patient come like that, I'm not able to conceive because of irregularity. And then the next question is, how have you gained weight? And then say yes, we have gained weight. Then again the very simple question will be, why do you think you have gained weight? So when we ask that, the invariable answer which comes from the patient is, as I'm not having my normal periods, so I'm accumulating that fat or blood, and that's why I'm gaining weight. That's a really wrong notion or a misconception. Because by having a regular menstruation doesn't mean that you're going to lose weight or you'll be in a normal weight. Yes, if you're not having proper cycles, there is definitely a little bit hormone imbalance which can cause fluid retention, but with the normal periods, there will be a little bit of fluid loss, and there is a little bit of variation in every woman. In every month, there is a weight gain and weight loss. So, coming to that question, does polycystic ovaries cause weight gain, or weight gain causes polycystic ovarian syndrome? As I said, polycystic ovary could be a normal finding. If you do a scan on 100 normal women, we will still find some 15-20 women who will have a polycystic ovaries. But polycystic ovarian syndrome, as we have already explained, that they should have irregular cycle, abnormal weight gain, they should have male pattern kind of changes. That can happen only if the hormone imbalance is tilted. That happens because of increased weight gain. So when you gain more weight, there is more fat amount, so there is more of hormones which are converted to the male kind of thing. So the hormonal imbalance increases, insulin resistance increases. That's why your cycles become irregular, more and more irregular. What the general teachings or the evidence says, that if you lose, suppose you come today with suppose 100 kg weight, and your cycles are irregular, even if you lose 5% of your body weight, almost 50% of women will get their cycles regularized, and out of which many will conceive normally and naturally. So it's vice versa. It's because of your weight that the polycystic ovary has turned into polycystic ovarian syndrome or a disease. Not that polycystic ovarian syndrome is causing this. I do understand that there is a familial pattern of weight and obese kind of thing, but then yes, we also need to look into what kind of diet they are taking here, because familial weight gain could be because of two things. One is genetic, another is maybe the family or the whole the community where they live is eating more of a junk food, or a food which is more rich in carbohydrates and more rich in fat. So those kind of food, those kind of habits needs to be broken to make things work for us. So when we are talking about this, next thing which we always tell is that lose weight. So the next question which the patient says is like, how do I lose weight? So what are the general advice as to will loss of weight help in this patient being in better life or not?
Definitely. Lifestyle changes, that is changes in your dietary pattern and exercises, this forms the cornerstone of treatment for PCOS. It is all about exercise. If you're on the obese PCOS side, then definitely weight loss will help you correcting the hormone imbalance. So when we talk about lifestyle changes, what do we mean? First let me talk about exercise. Moderate amount of exercise, that is we mean by exercise we mean some cardio exercise where your heart rate increases for that 30-minute period. That if you do it on a regular basis along with dietary changes, it goes a long way in treating PCOS without the need for medications. By dietary changes, we mean avoid junk food, avoid oily food, try to eat more of healthy food. You can have junk food once in a while, but as a pattern, don't be addicted to junk food or eating oily food. Restrict the intake of these kind of food.
So that means, should they diet? When you say about diet,
it depends on where you're standing at that point of time. If you're obese PCOS and your BMI is really high, then I would definitely say follow a particular diet, meet a dietitian. This is a multidisciplinary approach. Meet a dietitian, follow a diet till you reach the target weight. Once you are the target weight, you can have a maintenance therapy. And the other important component in PCOS is a lot of group therapy helps. When you work along with other people who have PCOS, you motivate each other to exercise, and you have goals. Somebody says, I ran 1 kilometer, I ran 2 kilometers. So you motivate each other. This really helps in the treatment of PCOS.
Actually, group therapy has shown to be very effective in losing weight. This is not just for PCOS; it's all even for the other obesities related issues. Again, as you were telling about the weight and the diet and exercise, as we very well know that exercise plays a 30% role in weight loss, where diet plays almost 70% of role in correcting the weight loss. So you need to really work on the diet. And I would really recommend you to consult a certified dietitian and also look into having this kind of a group therapy rather than just what I've seen is most of the time they download some diet from the
apps and it goes on for maximum of 5 days, and they're back to
them.
Eating junk
and then they'll be doing alone. See, when you do it alone, there is not much of a motivation force here. So when you do it along with your friends or a group which is there, so you motivate each other. It's more like a team game. So I think that really plays a major role.
Yes.
So when you say about avoid junk food, what are the main junk foods you think nowadays people are taking?
These things like Coca-Cola, the chips, the biscuits, all these are actually not at all healthy. You can actually, anything that is bought from the store in packets, oily, which is fried, is definitely junk food. So instead you can bake these things and eat homemade, whatever. It can be pizza, it can be burgers, whatever it is. Homemade is much healthier than what you're going to buy outside. So this is what we mean by junk food. You can have it like once a week, pizza, all that, but preferably start making these things at home. So that way, the calories are less and you're not eating too much fat. So this is the diet.
Like being an obstetrics gynecologist, we every day get 1 or 2 sweet box.
Exactly.
So it's like very tempting. But if you're very sure as to what goal you are wanting to, so you would definitely avoid it. I know what we kind of are, most of us follow here is, if we eat any sweet today, then tomorrow it's like a punishment. You need to run more. So if you can do that,
the day you eat, do the double exercise. Right. Alright, so now that we've spoken about lifestyle changes, coming to the medications, a lot of kids, a lot of 20-year-old, 18-year-olds come and say, Doctor, I've taken these hormone tablets for 3 months, I've taken 3 cycles, now the periods are irregular, but once I stop, it becomes irregular. So what do you feel? So anybody in the age, adolescents before 18, should they...
Actually, that's the problem here, because more, as you said, that after menarche, usually up to 2 years, we'll have a cycle little bit irregular. But it can extend up to 3 years, 4 years also. It's not necessary that it has to end at 2 years and by 3rd year it really becomes regular. That's one. Next is, if it is irregular, then we need to find out as to what is the cause. Again, the scan, blood test. Yes, many of these small kids between the age of 15, 16 are wrongly labeled as polycystic ovarian syndrome or a disease just because the cycles are irregular. What happens is, we would not want to do that because the criteria for an adolescent polycystic ovarian disease is totally different from an adult polycystic ovarian disease. So you need to consult a gynecologist before calling this as a adolescent polycystic ovarian disease. And once you have branded that child as polycystic ovarian disease, it continues to haunt them as to tell, oh, I have a polycystic ovarian disease, I have something abnormality in that. So that should not be done. Next is, how do we take care of this irregularity? Now, what has this irregularity caused? Sometimes because of this irregularity, bleeding will be more, or it may bleed so irregular that you cannot expect when it's going to bleed. So if that is the case, then we may put her on some progesterones, not the estrogen combined ones. Because progesterones, we can always say that once in 40-45 days you can have this tablet for 5 to 7 days and have a programmed bleeding, so that your bleeding is not really heavy, not prolonged, and not kind of irregular or heavy one. We would not recommend using estrogen combined pills up till 21 or 22 years of age, considering the girl may still continue to grow, and estrogen or exogenous estrogen may interfere with the growth of the child. So, if it is needed to be put on the estrogen or progesterone combination, we generally do it after 21 or 22 years of age. Till then, we would still advise them to monitor their diet, do regular exercises, and reduce the stress levels. Yes, again, at this age, when you're talking about 16, 17, 18, is that the crucial school time where the career is very important. You need to pass 10 standard, 12 standard. So the stress levels are more. So cycles may become a little bit irregular. So very simple thing is, we would rather wait for 40 days or 45 days, and take a progesterone tablets for 5 days, which would actually make sure that your cycles come on time, and also it's in the normal duration and the quantity. So when you talk about this, another thing which we've also seen is that many of these patients undergo surgery. Okay, so telling that cyst निकाल दिया है और ovarian cyst निकाल सकते हैं क्या? Can we remove this cyst out of our body? Is it necessary to do this?
See, like we've explained, the word the polycystic ovaries includes cyst, the word cyst, but actually it is not. It's a misnomer. It's not that there is a huge cyst which requires a surgery. There are multiple fluid-filled follicles. So this does not require surgery per se. I mean, it's not that we do surgery and PCOS is cured. It's not that it's not going to come back. Remember, the main pathology is the anovulation is continuing. So you will again develop these follicles. Surgery is not at all indicated as a cure for PCOS. It has a role, at a later stage when we talk about fertility and when the patient is not responding to ovulation-inducing drugs. And when we check the hormone profile, we look at one component called LH. If it's really high, then we know that the androgen content is more. So by doing a surgery called ovarian drilling, we reduce this androgen content, and that actually helps with ovulation later.
So it is not cystectomy. It is only drilling, only for infertility.
Exactly. So per se, surgery is not a solution for PCOS.
Yeah, this is correct. When we talk about surgery, surgery is only called drilling. Drilling is only done in when the patient is not able to conceive. That too, when we have tried almost 3 to 6 months normally to make the pregnancy happen. If it has not happened, yes, we can do the drilling. But still, drilling is not that, it's a cure. You may get your regularization, you may start having normal ovulatory periods may come in, but then if you don't change your lifestyle, then drilling is also totally useless. Yes. And drilling is most of the time we say that it can be done only once, not more than
once.
Yeah. So yes, I think we have covered most of the common misconceptions about polycystic ovarian syndrome and disease. And again, one of them, as I said, 3 months treatment and 6 months treatment. This is very common to when a patient comes and says, I have taken 3 months treatment. After that, I had 3 to 4 cycles normal, and now again it's become irregular. When will this, polycystic ovary be cured? Polycystic. See, as I said, lifestyle. If you do not change, it cannot be cured. So it all lies within you. If you ask us, yes, it's all within you. If you change the lifestyle, it can. Next, we cannot say that polycystic ovarian syndrome disease. Polycystic ovaries can be cured. Polycystic ovarian syndrome or a disease can be cured. That means your irregularity, your hormonal imbalance can be cured. Polycystic ovaries may and most of the time persist until unless there is a certain time in a woman's life that number of eggs have decreased in number. So and over a period of time the number of eggs come down, so the cycles may become a bit irregular also. But polycystic ovaries cannot be cured. Polycystic ovarian disease can be cured, but it's, as I said, 90% of that lies within that child or a woman's hands, that if they are able to have a determined mind to change their lifestyle and live a healthy life, it can be managed. So I think we have covered most of the misconceptions or a general misconception regarding polycystic ovarian syndrome. We would again come back to you, or if you have any more questions, you can put it on our Facebook. We will answer that later. And yes, we would, as again, this polycystic ovarian disease can have a long-term life effects, implications, and again, it is a major cause of infertility. We will have one more Facebook session on this topic.
Yes, our next session is on how PCOS affects fertility, because I think most patients are so worried about conceiving with PCOS. So Dr. Sunil and Dr. Smriti will do the next session on PCOS, fertility and the long-term implications the next Tuesday.
So as we have already spoken, any questions are there, please post it to us. Next session we will definitely answer it. Thank you.
Thank you.